Hi, so today we're here to do the head and neck assessment, and I have Carmen with me. She's going to be my patient. Carmen, do you mind if we use this and I show it to my school for educational purposes?
Yes, that's fine.
Okay, so she is agreeing. She is over 18, so we're going to go ahead and start. We're going to do the same thing. I'm going to pretend that I'm walking out, and then I'm going to be walking in, and then I'll continue to explain the assessment from there. So I'm walking out. I'm going to be knocking. Knock, knock, knock. I come back inside. I close the door for privacy. At this point, I'm going to wash my hands for hygiene. Then I'm going to introduce myself to Carmen, and then I'm going to double verify her name and date of birth. So, hello, Carmen. My name is Jasmine. I'm a student nurse. Can you please tell me your full name?
Yeah, my name is Carmen Saavedra.
Okay, and can you please tell me your date of birth?
Yes, it's January 14, 1975.
All right, thank you for that. So I'm going to go ahead and start with the head and neck assessment. I'm going to inspect your head for size, shape, and configuration. So I am inspecting her head, and then it appears to be normal and in proportion to the body. It is round and symmetrical. Next, I'm going to palpate the cranium. I'm looking for any masses, indentations, tenderness, skin break, or any infestations. So I'm going to go ahead and palpate your cranium. If it's uncomfortable, let me know, okay? Mm-hmm. So I'm palpating the cranium for any indentations. I'm also looking for any infestation, any skin break, any soreness or tenderness. All right. So there, now the next thing is I'm going to inspect the face for symmetry, features, movement, expression, skin conditions, or any involuntary movements. This involves the cranial nerve number 7, which is the facial nerve. So I'm looking at the skin right now, her face skin, and it looks nice and pink. I'm looking to make sure that it's symmetrical, no drooping. Carmen, can you please close your eyes tight, open them wide? Can you smile? Can you frown? Frown. Okay. Can you puff out your cheeks? Good. So she was able to do all of that. All of those movements so they were symmetrical and well coordinated, which confirms that cranial nerve number 7 is intact. Also, there was no indentations, any infestation, any redness on the cranial. Next, we're going to be moving to cranial number 5, which I'm going to be testing for the trigeminal nerve. Carmen, can you please bite down, like clench your teeth? All right, good. So the next thing is that I'm going to feel her masseter muscle. So I'm just going to feel. All right. Also, I'm going to feel the temporal muscle. Good. So both masseter and temporal muscles are strong with contraction. Actually, can you open your mouth and close? Open it. Yeah. Good. Yeah, they're both strong with contraction. The next thing is I'm going to use a cotton ball to test the sensory function. So I'm going to have you close your eyes, and then I need you to let me know if you feel it, just let me know now, okay? So I'm going to be using that. I need you to close your eyes for me, and I'm going to be let me know if you feel this, okay? Mm-hmm. Tell me now.
Yes.
All right.
Yes.
All right.
Yes.
Okay.
Yes.
Uh-huh.
Yes. Yes.
All right, good. So Carmen, when you is able to feel the soft touch on both sides, the forehead, the cheeks, and the jaw, which is a good sign. Okay, so now I'm going to palpate the temporal artery bilaterally. So it's right here next to the vagus. All right, so the artery feels smooth and I could feel the pulse is about, which indicates it's about a 2+, which is normal. And do you have any tenderness?
No.
She doesn't have any tenderness, which is also good. So next, I'm going to palpate the temporal mandibular joint. So just look straight. I'm going to. Okay, Carmen, can you open your mouth and close? Good. So what I was doing is I was feeling for any grating or clicking sensation. It feels smooth and there's even movements of the joint, no tenderness, swelling, or crackling sounds. The jaw opens and in a straight line without deviation, which is also good. The next thing is I'm going to assess the neck. For this part, I'm going to be inspecting the position, the symmetry, any lumps or masses on the jugular venous, or for any, like if you have a jugular venous distension. So for this, I'm going to use my pin light. I'm going to have to just kind of turn a little bit like that. And then I'm going to be looking at the JBD on this side to see if there's any distension, which it looks normal. Now I'm going to be looking at this side. And it looks normal. The neck is straight, and also I'm going to be looking at the trachea and the midline for symmetry. Make sure there's no lumps or masses or any abnormal pulsations. So I'm also going to be using my light. It's going to be looking at the trachea, and it's midline, it's symmetrical. I don't see any visible lumps or masses, so that looks pretty good. The next thing is that I'm going to inspect the range of motion. So Carmen, I'm going to have you tilt your neck down, or look down, and then tilt your head back. All right, and then now can you drop your ear to your left shoulder? Good. And now do the other one. Good. So all right, thank you, Carmen. So next I'm going to have you rotate your neck from left to right. So you're going to look to the left and you're going to look to the right. Good. Now can you elevate your shoulders? So put your shoulders up and down. Thank you. Now I'm going to put resistance against your shoulders, and don't let, put your shoulders up like this. And then don't let me push down. Good. So your neck moves smoothly, symmetrical, and your range of motion is intact on all directions. So there's no stiffness, no abnormal sounds. So we know that cranial number 11 is intact. The next thing is that I'm going to palpate your carotid arteries on one side for strength and equal, to make sure that the strength is equal bilaterally. So what I'm going to do is I'm going to inspect the carotid artery. And the pulse is strong on this side, so now I'm going to do it on this side. And I could feel it right there too, so it is equal bilaterally. The next thing is I'm going to palpate the trachea for any deviation, masses, or displacement. So I'm just going to inspect the trachea. All right, so trachea is midline, no tenderness, masses, or displacements. Now I'm going to palpate the thyroid gland. And I'm also going to have you swallow or take a little drink of this, if you can take a drink. And then swallow to see. All right, good. So the thyroid is not visible. It moves up and down with swallowing. I don't see any enlargement or tenderness. It moves correctly. And then I'm going to palpate to see, but can you swallow? Good. So in both situations, the thyroid moves up and down with swallowing. Next, I'm going to palpate the lymph nodes for any swelling, enlargement, or tenderness. And we're going to start with the submental. So I'm going to go behind you. And I'm going to start with the submandibular lymph nodes. So I'm going to start at the jawline and checking for any submandibular lymph nodes. Then the tonsillar lymph nodes. Then I'm going to move up and check the pre-auricular in front of the ears. Then the post-auricular behind the ears. Then the occipital lymphs. So the occipital lymph nodes. Then I'm going to assess for the anterior and posterior cervical change, which everything looks good. All right. So the lymph nodes are soft, movable, and non-tender, symmetrical bilaterally, and non-palpable. Which means that we've concluded the assessment and everything look okay. Thank you. Bye.